So starting off, I just want to thank Dr. Law and her amazing team for the invitation to come and speak to you all today about PPE plastic pollution and the pandemic. My name is Justine Ammendolia, and I am a marine biologist by training. I did my master's in marine biology at Memorial University. I currently work as a data analyst for the environmental NGO Riparian, and I also sit on the Youth Council for the Chief Science Advisor of Canada. So I have a bit of an interesting background with marine biology. I have spent the past 5 years of my life investigating the role of plastic pollution in our environment. And within the various projects I've been a part of, I've always been fascinated with better understanding plastic pollution sources, their movement once they enter the environment, and consequently where they ending up in terms of fates. Now, with regards to my job that I held in Newfoundland, I spent 2 years combing the coastlines around the island, trying to identify different plastic profiles of beaches to understand better mitigation policies that we could implement. I found myself moving back home to Toronto in late 2019, which is what was supposed to be for a brief stint before heading off to Alaska. But disclaimer in the story, the pandemic happened and I was consequently stuck in my childhood backyard, trying to figure out how to apply my marine biology training to a relevant project in my area. My interest in PPE plastic pollution began at a trip to the grocery store with my partner, Jackie Saturno, who's also a plastic researcher. And we came across this site right at the edge of the parking lot. And it was literally just a graveyard of face masks, disposable gloves, and wipes. And what really struck me was this category of plastic debris, first of all, because I never saw this when I was monitoring out in Newfoundland, but also just the sheer volume that was present. The density was so high of this pollution that we knew that since this happened in March 2020, that this was the onset of something different, a shift in our plastic landscape. And we decided that we wanted to monitor and survey this problem as the pandemic occurred. So before I get into our survey data, I want to bring you through a picture of what plastic pollution looks like in Canada and also a little more about PPE. So starting off, in pre-pandemic Canada in 2019, the federal government announced amazing measures to reduce single-use plastics by implementing a plastic ban in 2021. This would target consumer plastics, things like stir sticks and disposable cups from public use. And what's great about this is the fact that every year we start to see more and more plastic being produced globally. And it's becoming such a problem that we don't know how to manage this waste. In fact, Canada only recycles 9% of its plastics. And this isn't because people don't know how to recycle properly, but rather the cost of oil is so very low that plastic producers are often compelled to create virgin plastic from oil as opposed to using more expensive alternatives of recycled plastic. So PPE is personal protective equipment, and it's a special category of plastics that really isn't recycled or doesn't really enter our mainstream waste management system. But rather, this category of plastic is used by various industries like medical, research, and other industries with the intention to protect workers against infection and injury. Basically, PPE, if you're using it in a medical setting, most of you might know that if bodily fluids get on it, it can categorize this plastic as biohazardous waste. And therefore, it enters very tightly regulated waste management systems that often include incineration as opposed to just putting in landfills. PPE is often plastic-based in material. Plastic can take form in many different polymers and be used to craft different forms of PPE for different functions. Plastic is really inexpensive to use, therefore it's suitable for mass production. And most notably, it creates this culture of disposability and really promotes sterile environments in which it's being used. So prior to the pandemic, I'm sure most of you know, PPE wasn't part of the vocabulary of most households around the country. In fact, this was something really just reserved for industries. We started to see in March 2020 a bit of hoarding happen across the country with people mass accumulating it. But then once companies and retailers kind of got their heads above the water, we started seeing a flux of products available on the market. Things like face shields and shoe covers that we would normally only see in hospitals became available in big box retail stores. And seeing pictures like this really invokes questions about the sustainability of producing all this single-use plastic for a consumer market. And for example, if you see the picture of the bucket there, that contains 800 disinfectant wipes that are intended for single households. Now, looking at how disposal is practiced within industry where there's tight standards and very hard regulations in terms of bringing it to incineration process or facilities, this isn't present with the domestic handling of PPE. In fact, most local municipalities are struggling to get their messages out with indicating to or telling the public that they have to tightly seal gloves and masks in plastic bags before mixing it in with domestic waste. Over the course of the pandemic, it's resulted in a flux of use of PPE. Per month, it's been estimated globally that we're consuming 129 billion face masks and 65 billion gloves. And that's on a global scale, and it's a very conservative estimate that probably exceeds this. PPE can cause damage to a variety of different sectors if it's mismanaged, starting off with waste management systems. In this picture, you can see masks are in the paper, in the recycling section, which they aren't, they're plastic. Or PPE can get out into the environment and harm wildlife through entanglement or ingestion. And most notably, it can cause infrastructure damage to existing facilities and systems, such as sewers. Plastic can also break down over time and form microplastics, which are less than 5 millimeters in size. And it is virtually impossible to clean up the environment of microplastics once they're in. And what you see here is a nitrile glove that's already broken down to that stage, unfortunately. So going back to that conversation in the parking lot with Jacqueline and I, we were trying to sort out how we were going to get a handle on measuring the amount of PPE entering our environment within our local area. And we decided to focus in on the question, how does human activity influence PPE debris? So under the restrictions of a pandemic and under provincial guidelines, we decided to keep it local and restrict most travel to our neighborhood. So we started a survey that we incorporated in our daily walks around the neighborhood. And what we did was we monitored and mapped out geospatially where this pollution was occurring. We looked at recreational trails, residential areas, grocery store parking lots, as well as the hospital district in downtown Toronto. And this is especially unique because this, the Discovery District as it's called, hosts almost a dozen different medical facilities for public use. And we really wanted to see if there was any spillage occurring from these very tightly regulated institutions. And just to note, all these places occurred or all the monitoring occurred in Toronto. So just to show you on a map, we were mostly on the West End in our neighborhood. We went downtown to visit the hospital district, and we also visited a supermarket that was a bit away from us. What resulted was supposed to be a 3-week monitoring project, but instead, like any science project, it evolved. We spent 5 weeks putting together data for this paper, which was published in December 2020. And we continued monitoring on a weekly basis for 6 full months to get a pulse of what PPE pollution looked like over the scope of the pandemic. Between 2 people going out for daily walks, we collected 1,300 pieces of debris, which is nothing when you think about the geographic area we scoped. We analyzed a very small slice of Toronto, which is 1 city in the world. So you can imagine what this spillage looks like internationally. We documented profiles of PPE that were occurring and found that most commonly, gloves occurred, as well as disposable face masks and disinfectant wipes. And out of the masks, we actually found that 3% of what was ending up on the ground were reusable masks. So even the quote unquote sustainable option, might not be completely sustainable in the long run if there is spillage. Looking at our broader results, we found that disposable gloves made up the majority of the waste that we found, which isn't surprising really when you consider that we have 2 hands instead of using 1 face mask when people go out. And also in terms of the human activity, we found that the most PPE ended up in parking lots, which makes sense because they're high traffic areas. People going to buy food would often visit there. But more surprisingly was the fact that the hospital district in downtown Toronto had the 2nd highest rate of PPE density. Considering what I told you earlier with the system having a very tightly managed and regulated system for PPE and biohazardous waste, this definitely raises eyebrows with the amount of spillage that's occurring in this area. Now, looking forward for why PPE was mismanaged, it could be a number of reasons. I'm not going to cover them all, but I really do believe it's the lack of messaging for disposal practices, as well as the lack of appropriate collection containers that aren't sufficient to A, hold PPE in there, or to insert it by the user. In terms of recommendations, I can go on about this for days, so I'm going to give you a couple short ones. Starting off, the government educational campaigns need to be more apparent and need to be stronger to influence proper disposal. And we have to start labeling instructions on product boxes, both from the retailer end of things as well as the producers. In terms of PPE use, we should definitely reduce disposable glove and disinfectant wipe for non-essential workers, given that the CDC and Health Canada both don't even mention these items in preventing the spread of COVID. It's really just down to face masks. We should also promote the reusable face masks for non-essential workers in our country. And lastly, any good policy is informed by multiple opinions. So therefore we need science and we need emergency funding for studies like this that take pulses on really important events. Lastly, communicating science is extremely important. So my partners, colleagues, and I have gotten out there in the media trying to share this message as much as possible. And just to end off, if anyone has further questions, please don't hesitate to contact me. And also a massive thank you to all our collaborators who made this work possible. Thank you very much.
Thank you so much, Justine. And now we're going to go on to Farah's presentation. Thanks, Farah.
Great. Thank you so much. So today I'm going to be talking about the impact of COVID-19 on Canada's next generation of scientists and professionals. Before I start, I do want to acknowledge the land on which I am tuning in from today. So both Justine and I are within the Greater Toronto Area region, which is home to many diverse Indigenous groups, including the Haudenosaunee, the Anishinaabe, the Chippewa, the Huron-Wendat, and the Mississaugas of the First Credit River. I do recommend that you all look up which land you are currently occupying today. So yes, my name is Farah. I recently completed a master's during the pandemic in the summer of 2020. I do hold a couple of roles right now. I am a genomics researcher at the University Health Network's Epilepsy Genetics Clinic. I'm also a researcher at Evidence for Democracy, where I'm looking into best practices for improving federal science communication. And I'm serving as a member of the Chief Science Advisors Youth Council in my spare time. And before I dive into the impacts of the pandemic, I do want to paint a broad picture of what graduate student education looked like before the pandemic became a reality. We know from a 2018 survey from the Canadian Association for Graduate Studies that there are over 175,000 graduate students across Canada. And there are both positive and negative aspects to graduate studies. I'm going to highlight some of the challenges first. So we know from a survey from the Science and Policy Exchange, a science policy group in Montreal, that many graduate students report challenges in obtaining funding. We know that many graduate students face challenges with their mental health, with a survey from the University of Toronto showing that 49% of graduate students reported struggling as a result of mental health, citing issues such as concerns over future employability, as well as instability and precarity of funding. And just today, a new report has come out from the Council of Canadian Academies looking at where PhD graduates are employed. And the foreword from Dr. Eric Meslin highlights that PhD graduates face a lot of obstacles when entering work after graduation. So taken all together, before COVID-19, there were already many cracks in the foundation for graduate studies, and really the COVID-19 has exacerbated these existing challenges and introduced new challenges. At the time when the COVID-19 pandemic became a reality, I was a graduate student at the University of Toronto, and I was also leading the Toronto Science Policy Network. TSPN is a student-run science policy group at the University of Toronto, where we provide a space for trainees and researchers to learn about and engage in science policy through workshops, panels, talks, and more. And in this March 2020, this time of confusion, all of the academic institutions across Canada had suddenly shut down, and so many of us graduate students were at home, confused, not sure about what was happening with our research, not sure about what to do next. And it was at this point that me and my team started thinking. We noticed that a lot of surveys had come out to look at the impact of COVID-19 on post-secondary students and undergraduate students, but none had really focused on the specific realities of graduate students. So graduate students hold multiple roles simultaneously. They are researchers in training, yet they're leading entire research projects and managing many collaborators. They are students attending courses, yet they're also instructors and teaching assistants, often supervising students in the lab or grading work from undergraduate students. And they're also student parents responsible for caregivers. So we didn't see these realities being captured by surveys at the time, and we decided to address this gap. My team of 17 graduate students and postdoctoral fellows, we sat down and we put together a survey consisting of 130 questions asking about aspects such as teaching, courses, health and wellness, research, future prospects, and we developed these questions in consultation with student groups and students across Canada. We launched our survey on the 22nd of April. It was a national survey, it was bilingual, and we distributed it through social media, through mailing lists, through emails, and anything and everything we could. On the 10th of August 2020, we were able to launch our report. You'll notice that it took a few months to analyze the data, and I do again want to reiterate that the entire team was living, working, and surviving through a pandemic. And this was something on top of the research and the many personal responsibilities that they had. To date, our report has almost been downloaded 2,000 times. It's been covered in outlets such as Nature News by news sections of institutions such as the Chemical Institute of Canada as a panel at the Canadian Science Policy Conference. I'm now going to share with you the demographics of our survey and 3 key findings. In terms of demographics, we had 1,431 responses representing 45 different institutions across Canada. Our respondents were largely female or white, 2% identified as Indigenous, and they were largely domestic students overall. In terms of a provincial breakdown, half of our responses came from Ontario, followed by Quebec and British Columbia. If you want to get specific about degrees, we have a mixture of both professional stream programs as well as research stream programs, with at least half pursuing a research stream PhD program. In terms of disciplines, we received responses from all disciplines, with the majority coming from life sciences, physical sciences, followed by social sciences. These demographics do seem to be representative of the Canadian student population based on pre-existing surveys. In terms of findings, I'm going to highlight 3. The first is the impact on research. Almost immediately, we saw there was this short-term impact on research, with 76% of graduate students reporting that the COVID-19 closures had had a negative impact on their research. They were able to carry out tasks remotely, such as writing manuscripts, defending degrees, attending committee meetings, but many are still concerned about long-term impacts. So among research stream students, you find that 39% are concerned that the pandemic will have a large or moderate impact on their degree completion time. And similarly, when it comes to future prospects, you still see that concern that the pandemic is going to affect or have some sort of impact on their future prospects. There were also concerns about finances and funding. So you find that graduate students are concerned about paying fees such as tuition fees, rent, credit card payments. And when it comes to the stability of funding, students are concerned about whether their teaching assistantships, whether their research assistantships, and whether their stipends will still continue. There were also a number of health and wellness challenges. So a lot of students reported feeling increased feelings of helplessness, of being overwhelmed, of feeling lonely, of feeling depressed and anxious. And similarly, we found that 26% of graduate students were considering taking a leave of absence, so taking a semester or 2 off for a variety of reasons. And this was only 10% when compared to before the pandemic. So overall, you might be considering at this point, but Farah, these results were from April 2020. Are these early COVID-19 impacts still happening? Haven't institutions taken measures to address this already? And I unfortunately do not have the greatest of news to share with you right now. The Chief Science Advisors Youth Council carried out virtual consultations in September and November 2020, and I'm going to share some of the responses and themes that emerged. In case you're not aware, Dr. Mona Niemer, the Chief Science Advisor of Canada, appointed a youth council in March 2020, right before the pandemic became a reality. And we are a council of 20 scientists consisting of undergraduate and graduate students, postdoctoral fellows, and recent graduates. In our first consultation, which took place in Science Literacy Week, which was in September, we heard a number of themes. So we heard from participants that COVID-19 was continuing to impact their learning. So they were worried about screen fatigue. They were worried about exam proctoring software. They were also concerned about how they would now continue to gain experience in our increasingly virtual world. There were also concerns about laboratory-based research. So many students expressed the fact that they felt they had to choose between their health and their research, because what if a second lockdown came around? They had to collect as much data as they could, but they were also worried about getting a COVID-19 infection. Similarly, we heard that COVID-19 pandemic was continuing to exacerbate loneliness, with students reporting increased challenges. Students did accept that, they did appreciate that professors had as much of a burden, but they were concerned about first-year students who had just joined a lab, or dealing with failures or failed experiments without the support of a supportive lab environment. And lastly, one respondent did point out that this is going to impact the competitiveness of Canadian graduate students in the years to come. So we're going to keep seeing the impacts of COVID-19, not just now, but in the next few years too. The next consultation we did was at the 2020 Canadian Science Policy Conference. So this was late November 2020. In case you don't know, this conference is more catered towards those with a science policy interest. So we started thinking about kind of the big picture and what are some questions that we should keep in mind as time passes. We still heard the same challenges. So we heard students tell us about how there's non-compliance with COVID-19, that students felt pressure to go into the lab and keep collecting data and keep continuing research, even though cases were continuing to rise in their regions. We heard about the toll on international students, about how international students have to pick a lab from a country far away where they can't meet in person, and it's just harder to make that decision. And we continue to hear about the impacts on productivity and how it's isolating to work from home, and it's hard to find meaningful research to complete, especially if you're in a pure wet lab-based research field. Participants did call for an increased focus on narratives, so kind of asking granting funding agencies and funding competitions to allow students to share how COVID-19 has impacted them, and for that to be considered in their funding applications. In terms of looking ahead, students were concerned about, are these just early impacts, or will these be long-term impacts in the years to come? And asking the question of, what is the value of a graduate degree after a pandemic? How will we transition forward? How will someone be compared from before the pandemic versus graduating during the pandemic? In terms of recommended actions, I could give you a lot, and I am aware that my time is running out, so I'm going to go through these ones quickly. In terms of graduate students, these are unprecedented times, so if you can advocate, but do take care of yourselves. It is exhausting, and please take care of your mental health. In terms of principal investigators and academic supervisors, we've heard from our surveys and our consultations that communication really is key. So meeting with your trainees, having reasonable expectations, encouraging participation in professional development is really important. In terms of departments or institutions, one important thing is to improve communication regarding remote work, especially during these provincial lockdowns or stay-at-home work orders. Graduate students are sometimes classified as essential employees, but sometimes not. So there's still that miscommunication that we're hearing. And then, of course, improving and increasing the level of mental health supports that are available, and reshaping the graduate experience to ensure that students are still benefiting and training as future scientists and professionals. In terms of levels of governments, for the provincial government, one is, of course, to help increase the number of mental health resources and services available. And in terms of the federal government, it does come down to scholarships and awards again, with keeping that EDI lens and understanding how COVID-19 will impact different students differently. With that, I do want to add two last things, which is, the first is, a lot of the efforts to track the impact of COVID-19 on graduate students have been done on a volunteer basis. For example, even Justine's survey into PPE was done on a volunteer basis. And we really had to start talking about how to make these efforts sustainable. And in terms of folks who are developing policies to support students, consult students. So we're a youth counselor here with the Chief Science Advisor. You can also set up a youth council. You can also set up a student representative, and this will really help inform your decision making. With that, thank you so much for listening. You can find me, you can find the Toronto Science Policy Network, or you can find members of the Chief Science Advisors Youth Council on CanCOVID. I'm going to stop here now.
Thank you so much, Justine and Farah, both fantastic presentations. And I just want to echo what Julia Zarb has commented in the chat box. She says that this is compelling work, and I agree with her. And so I know we only have about 3 minutes just to have, question and answer, but oh, perfect. We have, do we have a question there? Yeah, so we have a first question is from Dr. E. Grunfield, and he says lots of thanks, and he has he's particularly wondering about the ecology impact for PPE. So maybe Justine, you can touch upon that.
Yeah, that's a great question. To be honest with you, it's in such early stages of development with PPE accumulating in the environment that I anticipate seeing a little more of a biological impact within the next few months, probably this summer, once the snow starts to melt and we start to see more water enter mainstream rivers. Really, I think the main concern that most biologists thought right off the bat was the entanglement bit with the masks, particularly the loops and wildlife and birds. Early on in the pandemic, there were various reports on social media about that. In terms of the ecological damage on a smaller scale, that would be really interesting to test with a few laboratory experiments. So yeah, I would definitely, it's a complex problem, and I think there's gonna be a lot of interesting work coming out in the next year about it.
Apologies, Dr. Grunfield. Very sorry. It's hard to tell from Zoom. Thank you for correcting me. Yeah, so there's another question from David Lufty, and the question for both speakers, did your research lead to other questions that you would like to explore next? And what new questions do you anticipate in your area? So maybe we'll start with Farah and then we'll go on to Justine.
One of the things that I was very interested by was when I was comparing the Denver survey and I was trying to look for equivalent Canadian data to see how representative our survey was. And a lot of data to be out of date. There was a Statistics Canada survey that came out late last year, which looked at EDI statistics in the post-secondary sector, but it kind of lumped folks into the visible minority category. And now I'm very curious about, we need these stats to really see how diverse our graduate student population, see whether all of these surveys and these measures that we're taking do help all communities within graduate student population. Very interested in terms of data collection when it comes to EDI and in terms of new questions in my area. So one thing that I hear a lot every time I talk about the survey is people ask, what are you going to, will you repeat it? What do you think the results are going to be? I'm curious about this. I only think about this on every day that ends with a Y at this point. It is an important question. It is something that I would encourage every department institution to pursue at their level because you do have the resources to do it. And I'm not sure. I think that we'll keep seeing the impact on graduate students, long-term issues coming out. So in terms of whether graduate students feel competitive enough to pursue, how many will choose to stay in academia, and how many have decided to leave their program. I'm also interested in attrition rates amid the pandemic. Same question to you, Justine.
Excellent points. It's hard to follow up with that one. To be honest with you, I'm kind of shifting more to systems point of curiosity. I really, being limited by the pandemic with the various lockdowns, it led my partner and I to really just kind of do the bare basics of looking at PPE at the end of its lifespan, you know, what was ending up on our streets, our rivers, our sidewalks, etc. I'm interested in looking at the bigger picture. I really, really wish there was a way to get my hands on production numbers for PPE or retail figures on how much is actually going through our Canadian economy and our system, how much is ending up in the hands of Canadians, and what are the values that are entering our waste management facilities. Is there an increase in garbage that's been happening over the scope of the pandemic? And you know, kind of modeling it in a bigger way that you can deduce, okay, this is the number of how much is being mismanaged into our environment. How much worse is our environmental plastic pollution problem becoming because of the pandemic? I think that would be the million-dollar question, both on a national scale and international. But like Farah pointed out, and very kindly might I add, without funding, it's really hard to pursue these kind of questions. So creating that framework for that very small portion of the end of life aspect, hopefully will lead to opportunities to kind of build on that.
Thank you so much, both. So it is 4:32, 2 minutes past 4:30, so we're going to have to close. But I just, on behalf of the CanCOVID team and network, we'd like to thank you both for your time to present to us on your both amazing and impactful and also timely research. to us in our network. So appreciate it. Thank you so much. And just an update for next week. Please join us for our next speaker series, which is February 2nd with Dr. Yves Dubé on misinformation during the COVID infodemic. Great job again, and have a good evening. Bye, everyone.